McInerney from Croaky here, and we're at the very beginning of our Croaky Go on navigating health, looking at mental health issues and how to navigate pathways to support. And our starting off point is at the Victorian Aboriginal Health Service, VARS, which is very well known across Melbourne. And I have here Lionel Austin. Lionel, could you introduce yourself and your role, please?
Yep, so my name's Lionel Austin. I'm a Gunditjmara man. And my role here at the Victorian Aboriginal Health Service is the Preventive Health Manager. So we're mainly focusing on preventive key initiatives and pretty much health promotions as well. So that's my main bread and butter.
And we were talking about how Deadly Choices has become a big program now in addressing or trying to bring prevention messages to young people in Melbourne. Can you talk about that?
Yeah, so VARS have Deadly Choices now. I've had it for the last 2.5 years now. It was quite successful in Queensland, especially in southeastern Queensland, given that that was an urbanised area, and obviously Melbourne's very urban as well. So VARS at the time was looking for other successful programs or initiatives that has that outreach of community engagement to pretty much influence their community members to utilise their Aboriginal medical services more often. So that's when they decided to implement Deadly Choices into their model of care here at VARS, and it's been quite successful since the implementation in late 2017. But it didn't really get full traction until around about early 2018, and we've seen a huge increase of health assessments or health checks for our community members. What's really interesting is that in the last 3 financial years, we've seen a 68% of increase of health checks since the implementation of Deadly Choices. We can't solely put on Deadly Choices, but we do say the fact that Deadly Choices played a big pivotal role into that increase. For some reason, people love a free shirt. And we're very fortunate to get a partnership with Essendon Bombers as well, and also with the Long Walk. So they've been really instrumental as well in terms of utilising their partnership as well to have the increase of health checks as well.
What do they do? What?
So the Essendon Football Club has allowed us to utilise pretty much their IP or their intellectual property, which is mainly their branding and their logos and their colours. And given quite a few of our community members are massive Bombers fans, so we saw it as a perfect fit to team up with the Bombers, and that created the attraction for mob to come in because they want their own Bombers shirt, and obviously it's a Deadly Choices Bombers shirt. So that was the attraction for people to come into the doors and saying, oh, how do I get that shirt? So we say to them, you have to get your health check. And I love the model, that the fact that we don't sell the shirts, we don't give them away. The only way you can receive an actual shirt is through an actual health assessment, and that's what we want. So from a preventive point of view, the main thing is that the only time our mob or our clients access the Victorian Aboriginal Health Service is only when they're actually sick, which is it's a kind of a human natural thing. It's that obviously you're crook, you go see the doctors, but in reality, what we're trying to get our mob is to change the mind shift and basically saying that you should be utilising their local Aboriginal medical service all year round. And the best way to do it is actually get a health assessment and check out what your current health status is. So you can work with your clinicians and identify any risk factors that could lead on to further health issues later in your life, and where they can actually support you to prevent those certain illnesses or sicknesses down the track.
Fantastic messages for mental and physical health. Yeah?
Absolutely, and the main thing what we do around mental health, we have a high prevalence of poor mental health in our community, especially around drug and alcohol abuse, and then we have the issues of trauma as well, and also intergenerational trauma as well. So VARS has played a big key role, especially in Melbourne and Victoria, around how do we have a holistic approach around mental health, and that's why we now have a dedicated service called the Family Counselling Service, because we've been able to provide counsellors and psychologists and psychiatry to our patients who are in need in that particular area. And the main thing is what we're trying to teach our mob is that, especially around mental health, is that everyone kind of gets, down. It's kind of natural that you're feeling sad and all that. We all get sad, but if you leave it too long and let it progress, then that's when it becomes a crisis point, and that's when you are diagnosed with, depression or anxiety and all that stuff. But if you get a health check or a health assessment on the early onset, then you can identify it, or the clinicians can identify that early on, and then actually refer you to appropriate services to treat that, to prevent it even getting any worse. So that's the main thing what we're trying to teach, especially with our young people. That's why we're in the schools now here in Melbourne. We're very successful in terms of we're in 10 high schools alone in just in term 3. And one of the key aspects that we're trying to teach kids, obviously, is around chronic diseases, but also depression is a chronic disease. And that's what we're trying to teach kids, is that this is your service. Don't only use it when you're sick. You should be using it all year round. Get a health check. And the best time to get a health check is actually when you're in a good state. So you can actually assess anything going on an early factor, and then that's when our clinicians can support you to the appropriate services that you may need by identifying any issues that they might red flagged.
Fantastic. Thank you very much. Any other messages you'd like to give to people in the community or more broadly?
Yeah, no, look, it's really important that our mob utilise their local Aboriginal medical service, either it's VARS or anywhere else in Australia. That's why our AMSs are there. They're there for our mob. They are culturally safe for our mob, and they're pretty much they're our services. And our mob need to utilise their AMSs more often. And like I said before, is don't use your AMSs only when you're crook or when you're sick. Use it all year round. It's really important that our health is in good shape. And the only way you can, know that you're in a good shape, yeah, physically outside you may look good, but you don't know what's really going on in the inside, either here or here. So that's the main thing that we need to, empower our people to basically say, our AMSs are there for our mob, because that's what they're there for.
Fantastic, Trevor. Thank you very much, and thank you for welcoming us here this morning at the beginning of our Croaky Go.